Hear the latest reporting and analysis on the big stories of the day on the Daybreak Insider podcast. It's top-notch reporting from SRN News, along with the sharpest insight from Hugh Hewitt, Mike Gallagher, Dennis Prager, Sebastian Gorka, and the voices of townhall.com. The Daybreak Insider podcast. It's your first look at today's top stories. Available at Apple Podcasts, Spotify, Google, and at SalemPodcastNetwork.com.
Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Oh, yeah. Hail, the gang's all here. Welcome aboard. Thank you for being with us. If you're a returning regular, we appreciate your attendance. And if you've had a good result, and if you've been treated by Vein Clinics of Hawaii and want to crow about that, we'll give you the opportunity to do that. The show is recorded, so we can't exactly get you on live, but we can collect stuff. And over the last several weeks, and usually the shows that we do with Dr. Juliff has a start, beginning, and end, and we deal with all kinds of what he calls venous insufficiency, all the things that can happen to you. And every now and again, we stop in the middle of the road and say, you know what, let's entertain what the listeners want to know about. And you can always do that by communicating with us at veinclinicsofhawaii.com. And what we do is we develop something called the mailbag. And every now and again, I just say, Doc says, hey, how about we do a mailbag? And then we spring a bunch of questions on him. I'm always very, very confident that no matter what your question is, the doc has the answer. And that's because this is his calling, and you'll learn a little bit about that. Dr. Juliff sort of secured his route to becoming a vein specialist. He's actually a cardiac surgeon, and all of these different things mean that I don't care what question you have. If he doesn't have the 100% answer, he'll get you close enough. So with that, are you ready to test your energy on a scale of 1 to 10? Are you a 10?
I am ready to go, Mike.
Okay.
I am ready to go.
I like these because,
Oh, yeah.
We've often said this on the program. There's no such thing as a dumb question.
Mm-hmm.
And even though some people think, boy, that's a dumb question, it's really not. And I think it's been indicative. And we've sort of figured this out. I think for everybody that asks a question, there's probably 100 that are listening that have the same question.
Right.
And you know what happens, gang, is we'll have a show, and then a couple of weeks later, somebody goes, hey, you called about somebody that got a vein problem when they were traveling. Boy, I think that just happened to me. That's why you can ask these questions. So let's get right into it. And in many cases, I have the caller's name or the person's name or where they're from. And this one is a guy named Roy. His last name starts with an H. He is in Waipahu, and he says, he wants to know, what about veins that stick out on his forearms and his hands? Could they be varicose? And if so, should they be removed? And I've seen those. I got a couple that are like that. Not everybody has them. They kind of like bulge out.
Right. Yeah, and we have a fair number of people that come in with that as a complaint. A lot of people come in, they don't even have leg problems, but they have veins on their arms. They're very prominent, and they don't like the way they look. I mean, so for the most part, it's a cosmetic issue. He used the word varicose, and that's a good word. Are these varicose veins? And really what that is implying, or what that question really is there abnormal function in the veins in my arms? Similar to what someone might have with respect to abnormal function of veins in the legs, and the answer to that is no, because it's a whole different kind of mechanical sort of situation in the legs versus all other parts of our body.
Okay, but however, the writer question with that always is going to be, how come bodybuilders, particularly, are able to develop that? It seems like because they are bulging when they're doing their posing. It's like, holy smoke!
Yeah.
Look at that guy. He
Well,
must have extra veins.
Yeah. Well, some of them do.
Yeah.
Well, that's for two reasons. Number one, bodybuilders, they have such a low level of body fat.
Sure.
And as the body fat decreases, the veins that are within the subcutaneous layer of our body, they become more prominent. And then in addition, they're straining all the time, and when they're straining, they are putting a certain amount of backward kind of pressure on the veins on the arms and the legs. But bodybuilders also develop venous insufficiency of the legs. Now. Yeah, and I treated a bodybuilder a couple years ago, and he had a huge number of varicose veins, but he also had normal-looking veins that he wanted to keep. He didn't want to get rid of all the veins because they like the appearance of some of those veins. So. But getting back to the arm thing, is it a problem? No, it's not a problem. This person has, for whatever reason, prominent veins. Now that being said, are there valves within the arm veins just like there are in the legs? Yeah, there are.
Yeah, I just learned something.
Yeah. So as far as the blood flow mechanics go, it's similar. But those valves, whether it's genetic or whether it's the mechanical pressure that we exert on the veins in our legs because we're standing up most of the time, we don't see that in the arms. They just don't tend to fail in that way. Now, again, that being said, do we treat arms veins and hand veins? Yeah, we do.
Okay, I got one, and this is personal. A long time ago, when I was a lot bigger than I am now, it was hard for them to find a vein for me to take my blood, because I had so much around it. And now they're sticking out and thinking, I like these. But I'm thinking they're also closer to the surface. And are these veins, is it dangerous? I mean, a laceration to laceration, right? If you cut one of these things, of course, you've explained it before. I know it's not like an artery. It's not going to gush blood.
Right.
But it can be a problem.
It could be a problem in specific situations, but a superficial vein, for instance, on the arm, even if it's prominent, is that going to rupture to the point where you're going to be actually bleeding from that vein, just from normal everyday trauma? No, it's very, very unlikely. If you cut it, if you're trimming the shrubs or whatever. And you cut your arm or the back of your hand, could you have some bleeding? Yeah, you could have some bleeding, sure. And depending on how big that vein is going to kind of determine how much bleeding you might have. But yeah, as you alluded to before, venous blood is not under a lot of pressure. So, and the veins that do bleed in that kind of setting are very superficial. So it's pretty easy to just put some pressure, compression on that area, and the bleeding should stop. When do we treat arm and hand veins? Well, again, basically it's a cosmetic issue. It's not a medical problem issue. And usually it's women. Usually it's a little more older women who come in, especially the back of the hands. Older women, as we age, the veins become a little more prominent. Number one, and then also, just kind of the soft tissue around those veins starts to become depleted. The elasticity of the skin and the collagen and all that sort of stuff that kind of is starting to go away. So a lot of older ladies don't like the way their hands start to look because all of those changes make their hands look older. So, do we treat that? Yeah, we do. For the hands, most of the time we treat that with injection sclerotherapy, and sometimes a good number of times I've treated arm veins with phlebectomy, microphlebectomy, the same sort of thing that we do on the legs, which it means that we numb the area up real good. We make little needle puncture sites through the skin, and then we can pull those, very superficial, bulgy veins out through those little puncture sites. And it actually does a very good job. I mean, the people that come in and want that done in general are pretty happy. And, the injection sclerotherapy that we do for hand veins also is pretty successful, and sometimes we have to do it 2 or 3 times, but we can get rid of those veins.
Okay, there. So Roy, I hope that helps. And now this is actually, I think this is a atypical of a question that comes up a lot. I know that it came up a little bit for me. I've heard other callers and some of our other guests, some of the patients that we've had on the air. Ellen from Maui wants to know. Maui, by the way, you can go to the Maui Vein Clinic in Hawaii, by the way, wants to know why her feet seem to swell up every day when she's working as well as her 100 days off. Could that be a vein problem? I've heard that on other shows. Swelling is a big deal. We talk about that a lot.
Yeah.
And as a doctor, I'm sure there's any number of things that cause swelling. How many of those could be vein related?
Quite a few of them. Swelling is a very common feature or a common symptom or finding that we see in people with venous insufficiency. The reason for that is because as the veins in our legs fail, blood starts to go in the wrong direction, and it's not only the blood going in the wrong direction, but it's an increase in pressure in the entire venous system that then leads to fluid kind of backing up and getting into eventually the soft tissue of our feet and ankles and lower legs. So that's a very common problem. And as we've talked about recently, swelling is one of those, the swelling is a separate clinical classification of, how we look at and approach venous insufficiency. So if somebody has, chronic swelling like this, especially when they're on their feet a long time, at work, even when they're sitting, standing in one place is the worst thing that you can do with respect to, vein function. But sitting also for long periods of time without getting up and around, that can also be bad. So for those people that, find themselves having a problem with swelling, one of the first things that we look at is their vein function. So we have a lot of people that come into the office and their primary complaint is swelling. And we do a complete evaluation, talk to them about other symptoms that may or may not be related to vein disease. And then do our usual workup with respect to ultrasound evaluation, et cetera, et cetera. But swelling. Now, as you mentioned, is vein disease the only thing that causes swelling? No, unfortunately, there's a number of different things. But those other things typically are things like heart disease, lung disease, kidney problems, metabolic issues, electrolyte imbalances, that kind of stuff. But probably out of all of those, heart-related issues are probably the most common. Mm-hmm. The other, aside from venous insufficiency, the other thing that kind of goes hand in hand, and we talk about it periodically here, is something we call lymphedema. Lymphedema also can kind of add to the swelling. Lymphedema is something that kind of goes hand in hand with venous insufficiency, and lymphedema basically just has to do with the fact that there's a clear fluid, kind of clear body fluid that kind of accumulates in an extremity, because the lymphatic system is not functioning the way it should. Everybody's I think most people have heard of lymph nodes. Mm-hmm.
Those are things that hurt when you're sick or when you're infected.
They can enlarge, right? We feel them in the neck or in the armpit, but we also have lymph nodes in all other areas of the body. But there are lymph node systems that have to do with the drainage of lymph fluid from our legs. And, as that those lymphatic systems can start to, lose their function for one reason or another. We won't go into all that. But, lymphedema lymphedema goes hand in hand with venous insufficiency. Often, when one is present, the other one is also present. And so we sort of evaluate people coincidentally for both of those things.
Yeah, I remember a program that we did a while ago, and then I heard another doctor, another specialist in another field, talking about swelling is sometimes the body's warning system, and it lets somebody know that look at this thing, it's kind of swollen. Maybe you ought to look at it. Mm-hmm. Isn't it sort of interesting because does swelling sort of protect that area in some respects, or can it?
Well, you mean is the swelling happening with the intent of protection?
Or concern?
Well, yeah,
hurt,
sure.
Or pain.
Yeah, right. Well, in a sense, yeah, sure. The thing about swelling as it pertains to venous insufficiency and lymphedema is that, these people, most of them, interestingly enough, don't have the other very common signs of venous disease.
Oh, okay.
A lot of many people that come in with swelling as their primary complaint, they don't have a lot of, like varicose veins and that kind of thing. So often people don't know. Swelling is one of those symptoms of venous insufficiency that is not commonly known to be due to that. And that's one of the hurdles that we have to get over often with respect to symptoms and signs of venous disease that people don't know are connected with that problem.
Yeah, I like that because you actually have a checklist. And when something's swollen, you examine this, you examine that, and one by one, you sort of narrow down the more likely causes of it. And then, okay, that's my gig. I'm going to treat this person, or that's somebody else's gig, and I'm going to send them along. Okay, this is another one. And by the way, this is our mailbag show. That's why we're jumping all over the place. Dr. Julep and Vein Clinics of Hawaii handles all kinds of different things, and this program is sort of a compilation of some of your all input. And anytime you'd like to do that, just go to veinclinicsofhawaii.com on 4 islands. veinclinicsofhawaii.com and get your question in.
And along those lines, I tell people that, if they call on the telephone and they're not sure whether they should come in and see us or not, I always tell them, you should come in and see us because if they have any problems with their legs, unless it's an obvious, orthopedic problem or, something like that, if there's a question, then we will help them figure it out. We see plenty of people, week in and week out that don't, that their main problem may not be venous.
Hey, wait, I got this one. I've asked you this before, and since this is the mailbag, this is sort of neat because I myself, when my veins have been bothering me in the past, I got a dull, heavy feeling.
Yeah.
And some people have pain, some people have burning, some people have itching, some people have, contractions, and it's the same problem.
Yeah.
I mean, we sort of tell our doctor what is the most real to me. It feels hot.
Yeah.
Yeah. Okay. Right. Well, that's what it is to you. So but several explanations or self-diagnoses sometimes mean the same thing. That's fascinating to me.
Well, people will talk about things in a little different way, but they might be feeling the same thing. Number one. Number two, people with this problem of vein disease, venous insufficiency, there's such a wide variety of different types of feelings, sensations, complaints that people have. So again, if anybody's having problems with their legs in any way, shape, or form, and they feel like they don't know where to go, maybe, please come on in. We can see those people, and we can certainly figure out that it's not a vascular problem, either venous or arterial, and if most of the time we can sort of point them in the right direction so that they can find out what's going on.
Okay, here's one. I've been dying to get this one. This is our mailbag from Mrs. Santos. She asked about veins that have popped out on the back of her legs behind her knee and are sensitive to the touch. She had vein treatment in the past, but it was a long time ago and very painful to have them treated. how is treatment done differently these days? I'm sure that's because Mrs. Santos would have been listening to a previous show where you explained the difference in treatment, particularly for varicose veins inside, which are surgical deals.
Right.
But is that common to have something that pops out and then is sensitive to touch?
Yeah, they can be, especially where she describes it on the back of her leg behind the knee. For whatever reason, when people have varicosities in that region, behind the knee, they tend to be a little more tender. Now, I don't know if it's because of the fact that, it's the part of the leg that's bending all the time, and, maybe that has something to do with it. But, that's not, varicose veins can be tender, for sure. No question about it. Now, to answer the other part of her question, are things different now? Yeah, absolutely. Hugely
day
different.
And night, yeah.
And so, the things that we do these days are done so much more minimally invasive. Well, they're very minimally invasive as opposed to, the very invasive way that we used to treat things. And, the other thing is that depending on what this lady had in the past as far as treatment goes, if she had, kind of routine surgical vein stripping, which was, the primary thing that we did way back.
In the hospital, big deal. Yeah.
Right. It was done in the hospital. It was, it was done in the operating room. People had general anesthetic, which in and of itself, brings about a certain amount of risk to the procedure. But she probably had just the great saphenous vein. Now, the great saphenous vein is a vein that is more on the front of the leg.
I was going to ask that.
And so that was the main vein that we surgically stripped back in the day. And so maybe she had reflux in that vein, and that was addressed with that procedure. Now, back at that time, we weren't really doing a lot of surgical intervention for venous problems on the back of the leg. The back of the calf in particular, there's a vein called the small saphenous vein. There's a vein in the upper thigh on the back of the leg that's called the posterior accessory vein. Well, those veins were not routinely addressed in the past. So she very possibly has developed now over, the interim years, reflux in those veins. And again, those are veins that we can address very easily in a very minimally invasive sort of fashion.
Would some of them, doctor, be a little bit different in that a lot of times if you see them or if you have symptoms and pain, and then now we don't really see the back of our legs all that often. I mean, somebody might say, what's that thing on the back of your leg? What thing? And then all of a sudden that's how you discovered it. But what about, this always comes up, and it's sort of a sidebar question. We had this on another one. I think her name was Leilani, but I can't find the paper. But she wants to know, she says that she now has had, after years and years and years as a secretary, and working behind her desk with her legs crossed, she has issues with varicose veins on the back of her legs and on the front of her legs, and wants to know if that was sometimes from sitting. I guess if you sit at a desk all the time, and I don't know how to cross my legs, so I don't do that. But I do know that's a very common way to sit. Can that be a problem? Mm-hmm. Can it be a problem?
Well, that was one of those things that in the past people said, "Oh, gee, don't cross your legs because it's going to give you bad veins." That's
a falsity, I think.
Yeah. Well, it is in a sense. I mean, there may be some situations where it would kind of worsen or progress the process, but venous insufficiency by and large in most people is a genetic problem. So it's something that we inherit from our parents and grandparents, and you can't change that, unfortunately. So that's a given. Now so in most people, I would say there is that genetic component, and then in addition, then there are lifestyle issues that are going to add to the progression or the severity of the disease process, occupational issues are definitely one of those things. Now, standing in one place, like I mentioned before, standing in one place is the worst thing that you can do for vein function. So, when we talk about occupations where that's happening, we think about hairdressers. we think about people like pharmacists or retail of any kind. So many of those people are on their feet, and it's not like they're walking around a lot. They're just standing in one place. That's the worst thing that you can do. Now,
like at a customer service counter when people are lining up and you're standing there all day long.
Oh, yeah. Now, in addition to that, or probably sitting in one place for a long period of time with your legs, your legs are down. Yeah. You're sitting in an upright position for all day long. That's also not that good. People who have an office job and they sit, we encourage those people to, frequently get up and walk around, go to the coffee pot or the water fountain or whatever. To get a little bit of that muscular activity going, which is going to enhance, vein function and keep the veins in your legs healthy. So this lady, the lady that you just mentioned, with respect to, sitting behind a desk all day long for many years, that probably was bad. Not necessarily because of the fact that she was crossing her legs, but probably because she had that genetic predisposition to develop vein disease, and she was in an occupation where she was at a little increased risk because of the fact that she was sitting in one position most of the day.
Yeah, and we get this a lot. I talked to a guy the other day at a big box store that's a listener, and he's a security guard in the front door of a big place. And he says, ever since he started listening to us, he was standing up all day at the door. Good morning, good morning, good morning. Now he goes and gets carts, and he rakes stuff up, and he walks around, and he says that, he's never as tired at the end of the day if he moves around instead of stand still.
Right.
That's really interesting, isn't it?
Well, that's exactly
the way it is.
That's exactly, that is such a, exemplary kind of scenario for what's going on, because, again, we need that muscular activity in our legs periodically throughout the day. Otherwise, if you have, some valvular problems and venous insufficiency, that blood is just settling down into the lower leg all day long, and you go home and you feel like your legs are dead.
I know an attorney that every time between clients gets up and he walks around this entire building. And one of the things that I do, I've got to make a confession. Number one, I fought kicking and screaming at Dr. Juliff in the beginning because he talked to me the importance of wearing these compression stockings, which I wear every day. That battle's over. But what I do now, and it's sort of interesting because even though my radio program during the week is sort of spontaneous, it's structured. So there's news at the top of the hour, the bottom of the hour, there's traffic. There's 4 breaks in an hour, and sometimes they're between a minute and 3 minutes. Everybody that works with me now says, why are you always getting up?
Yeah.
Because every 15 minutes, I'm guaranteed to be in a break.
Right.
And instead of sit there for 2 minutes, it doesn't even matter how much it is, does it?
No.
It's just a little movement. So let that be a warning. Maybe you're like that. If you are a television, let's say, a canvasser on, doing surveys or doing stuff on phones, between customers, walk 2 steps.
Right.
It's amazing what it's done for me.
Yeah.
Okay, here's one that this one sounds like it could be me, but it's not. But it is like when some person has a symptom like another. This comes from Paul, who is apparently in IAEA, and he's got a big bruise on his thigh that has been there for a long time. He says, does that mean that the blood has leaked out of his veins? Remember when we met, I had not a bruise, but a big web on the top of my thigh. And it was there for years. And you treated it with the sclerotherapy that we spoke about just a little while ago. And it looked really awful for a couple of months. I was never going to come back. And then, gone.
Yeah.
Is Paul really talking about a bruise, or is that something else? Because I was under the impression that bruises had a beginning, a medium, and an end.
Yeah, we're right. You're right. So there's a little bit of a question here by what he means by bruise.
Yeah.
Because a lot of people come in and they call their their spider veins or their webby kind of veins a bruise, because sometimes it sort of looks like a bruise. And a lot of people will associate it with an area that maybe they got hit when they were playing soccer 20 years ago or whatever. It's probably not a bruise. Now, to answer his question, Bruises do happen because blood is leaking out into the soft tissue. Yeah,
is that blood leaking out from the veins? Yeah.
Well, it's typically from the veins because it's the veins tend to be more superficial. Mm-hmm. Arteries, because they're a little more important.
Yeah. They're hiding.
They're deeper. Yeah. They're hiding. Yeah, luckily. Mm-hmm. So typically, if you get hit with something, for instance, on your thigh, that a bruise is going to form. That's from blood leaking out of tiny little capillaries and veins and that kind of thing. So, but does that process go on? Do those veins keep leaking? No. It's like you said, there's a beginning, a middle, and an end. And if it's a true bruise, it will go away with time. So probably he is talking more about some sort of vascular structure, whether it's a spider vein or, something that we call, reticular veins, or, and they come in all sizes, shapes, and colors and, appearances. So, it is probably something that we could do something with respect to injection sclerotherapy if it bothered him enough.
Yeah. There you go, Paul. So if it does bother you, get it taken a look at. That's the other thing. And one of the things that I thought it's fascinating about this, and even though it's not a question, it's just a remark I want to make, because I saw another lady who is actually going to ask us a question. She said the biggest thing she's ever learned listening to our program is about how much blood you have in your body, mm-hmm. and how far it has to travel and how fast it travels.
Right.
And so this veins and arteries and all the things that we talk about are really working 24/7, 365.
Oh, yeah.
And you would think that you had a lot more blood than you do, but what you're doing is you're spraying that at pressure throughout your whole system, even in non-waking moments. I mean, it's just never ending, isn't it?
It never ends. The heart is an amazing organ, and it's pumping blood every minute of every day that we're alive, I think that's a good point. People don't, a while back we had a little talk about those kind of things, circulation and what goes into it, and the blood volume and stroke volume of the heart, and et cetera, et cetera. But we only have about 4.5 or 5 liters of blood in us,
which really
most of the time.
It's not a lot.
Which is not a lot. Yeah. No, it's not a lot, and it circulates about every minute or so.
Yeah.
So
now wait, that's the part that got everybody.
Yeah.
Everybody that's learned that little factoid from you. What do you mean? It goes to every nook and cranny.
Yeah.
And it has to get out there, and then it has to come back and get recharged and go out again. So it just never ended. They're like, you talk about a treadmill. That's a treadmill.
Yeah. Yeah, that's a job.
Okay, here's one that's sort of related to the lady, Mrs. Santos. This is another question, but this is from a lady who says, my teenage son has a ropey vein on the back of the calf. Does he have circulation problems, and should it be seen?
Yeah.
Teenage boy. Now,
right. Right.
That's certainly not atypical, but it does happen a lot.
Yeah, it does happen. And, this is a good question, because it gets to the point of, number one, a lot of people feel that vein issues are mainly women's problems, but no, it's not gender specific. I mean, it's an equal opportunity, aggravation, and we see a lot of men. Nearly half.
I mean, every time I'm in his office, it's like 50-50.
Yeah, I was thinking about that just today, where I think most of our patients today were men, and there are plenty of days like that. So if it's not 50-50, it's very, very close. So it happens in men and women, and it happens in the young and in the old. They're one of the risk factors for venous insufficiency is age. And that basically, that's the risk factor of age. It just has to do with the fact that if you have that genetic predisposition to develop venous insufficiency, the longer it's there, the more likely it is that you're going to develop something. But aside from that, do we see it in the young also? Yeah, we do. I think the youngest person that I ever treated was 15. and that was a boy. That was a young boy. And we've had a good number of young boys and young men that come in with varicose veins, which is the main thing that kind of brings them into the office. Probably the worst varicose veins that I have seen, and this is just my experience, but the worst varicose veins have been in middle-aged and younger men, younger than 30. So, why is that happening? Well, probably because of the fact that they have a very, very strong family history. So, they've got a very, very strong genetic component to their venous disease. And then they're doing whatever from an activity standpoint. They're very athletic and they're, maybe lifting weights and, or they work in an environment where they're number one on their feet all day long and they're lifting heavy things, et cetera. But so this young kid, should he be evaluated? Yeah, he probably should.
Sure, probably should.
And the likelihood that he has venous insufficiency is probably pretty great. He probably does have venous insufficiency. Now, when somebody like that comes into our office, we are going to assess, how extensive is the problem and what is the impact to, that particular person. So, we ask about symptoms and, how long has it been there and, their family history. And then, of course, we get around to doing an ultrasound, and the ultrasound is going to tell us the extent of their venous insufficiency and how bad it is, all that sort of stuff. So you put all that information together, and we come up with the with the answer of should that patient be treated or not. And of course, the boy and the family is going to have input into that ultimate decision, and then we treat them just like we would treat anybody else.
Sure.
Yeah.
Okay. Yeah. And by the way, gang, this is really interesting because what Doc was saying, and this is a young guy. I have a friend named Larry, and before we go on, I just want to make a mention. Larry has twins, and one of the twins is diabetic and the other's not.
Right.
And one of the twins has, vein problems, and the other one doesn't. So, and these are twins. Now they're not identical twins. I'm not sure. Could identical twins have that much going on differently? I suppose. What do they do outside of when if their lives go in different directions? They can fall under any kind of diseases that the other one doesn't get. Correct?
Sure.
Yeah.
And a lot of medical sort of studies that look at the etiology of a problem. One of the ways that we figure out whether it is genetic or not is to study identical twins, not necessarily non-identical twins, but identical twins, because they have the exact same genetic makeup. And so if it's interesting to study identical twins because we figure out what they have and what they don't, and try to address genetic issues and all that sort of stuff. So so much of what happens to us is kind of determined by our life experience too. Is it nature or nurture or whatever.
Interesting too. I mean, even identical twins, if they have their different druthers, if one eats really lousy food and the other one eats really good food,
sure.
One guy gets to be a big kid and the other's not.
Right.
And they're identical. Okay, here's one that I think this is what I've been waiting for. I saw it on some of the notes that Dr. Julep sent. And these questions, by the way, the mailbag questions, they come in from a myriad of places. People will call the station after one of our shows and get details. Somebody will call the office. The easiest way to do this is to go online to veinclinicsofhawaii.com. veinclinicsofhawaii.com and contact us and send an email, and it'll end up on one of these shows. This is one that is major important, particularly here in Hawaii. And one of the reasons we've learned from Dr. Julep why he loves Hawaii so much is because it gives him as a surgeon a myriad of different folks to deal with. I mean, it's just all kinds of different interesting things. This one says, and we know about hereditary vein problems. I don't know about diabetes, but this one says, my mother had diabetes and eventually lost her leg because of it. I have swelling and varicose veins. My doctor says that I have borderline DM. What is DM?
Diabetes mellitus.
Okay, diabetes. I'm scared the same thing will happen to me. Boy, I feel a pain there because if you think that it could happen genetically, it probably could. That doesn't mean it's gonna. But how do you treat something like that when somebody says, I think I'm a train wreck. Look what happened to my mom. Am I next?
Yeah.
You know?
There's a lot there. But we get those questions all the time for sure. People with diabetes, they have vascular disease, but it's more on the arterial side. So, it's the reason that people with diabetes, maybe go on to develop ulceration. I mean, diabetes is one of those reasons that people who develop ulceration, just like venous disease. So we're, sometimes evaluating those patients too. But diabetes is a definite reason for, ulceration, for tissue loss, for gangrene, if their vascular situation gets too bad. So typically people with diabetes who have lost extremities or, whatever in over the course of their life, it's more of an arterial insufficiency problem.
Okay.
Your
arteries rather than your veins.
Yeah. So we're talking about a problem with the blood flow down to the foot in the leg. Yeah. Now, do people with venous disease, do they lose extremities? Very, very rarely. And this lady, although she's been told that she has borderline diabetes, it's not like she has diabetes that's been long-standing and she's been treated for many years. I mean, that's a whole different ball game. And she has findings and symptoms that are primarily related to, it sounds like, venous insufficiency, varicose veins and swelling, So her problem is more venous. I mean, just kind of looking at it superficially. And so she needs to be evaluated, certainly. She needs to be probably treated to, maximize her circulatory system within her legs. But her problem is probably going to be very easily treated, and just in general, in the long run, it's very unlikely. Even people with advanced venous insufficiency and venous disease, it's unusual for them to ultimately end up with an amputation.
Okay, but there's another sort of a rider to this, just because I'm curious, and that is, I do know that as a former type 2 diabetic, that sometimes I would stub a toe or cut a foot and didn't know it.
Right.
And I do know that that's a big danger, that people with diabetes shouldn't go barefoot in bad places and all of that. But why is that? Is it why are your pain receptors not good? Why don't you know when you get hurt on your feet as a diabetic? Yeah.
Well, that it's from the neuropathy. The diabetes has because we refer to diabetes as patients as having small vessel disease, and when we say small, we mean like the tiny blood vessels, and that can interrupt or impair blood flow to not only skin, but it can also impair blood flow to superficial things, in our skin, like nerves.
Okay.
So, people who have diabetes have what we refer to as neuropathy, and that's, people often feel that as, numbness or tingling in the sock distribution. Essentially, it's in the foot and lower leg, so. Like you mentioned before, if there is a lack of feeling, then they go out and they either they step on something and don't know it, or even the classic scenario is that somebody gets a little stone or something in their shoe.
Yeah, I've heard about that.
And they can't feel that it's there, and they may walk all day long on this thing, and then before they know it, it has eroded through the skin, and then it becomes an ulcer that doesn't heal.
You know what I've heard? I've heard of people that come home from a typical day at work, and when they take their shoe off, their foot, when they take their shoe off, it's full of blood.
Yeah, that can happen.
Yeah, and
that can happen.
That's a terrible thing.
Yeah. So, diabetics, especially those advanced diabetics that have very bad neuropathy, that's why they wear like special shoes. That's why they spend a lot of money on shoes and get personally fitted and make sure that they don't have any footwear that is rubbing on their skin anywhere or fitting abnormally that could result in that kind of a problem.
I have a very interesting question. I wish I'd have written it down, but this I learned actually when I was visiting and doing some work at the Institute for Human Services with the homeless.
Yeah.
And I do know that that homeless people that have conditions, it makes it doubly hard for them to keep clean and to keep things. And I do know that every now and again, whether it's diabetes or vein issues, that they can't move around anymore. They get in the ambulance and they're on all of these trips. That's why I think that this other question is similar to one that we've already had. But I do know that you talk, all you specialists talk with each other. It seems like the homeless community is at very high risk for ulceration because of cleanliness and because of lack of medicine and because of other things. But does a leg ulcer necessarily mean it's automatically going to get infected?
No, not necessarily.
That's what I learned about mine. That's why I asked the question.
Yeah. Not necessarily. And a lot of people will come in with a lot of people will come in with swelling and skin problems and, inflammation, a redness of the skin. And often that's misinterpreted as being an infection when it's not really. It's just the inflammation occurring because of the, pronounced swelling that has been there for a long period of time. But even when people develop ulcers, that does not mean that it's infected. Now, can those get infected? Yeah, they can.
Sure.
But typically they don't. If you culture the surface of the ulcer, you're going to be able to grow some bacteria, but that's just because we have bacteria all over our body and that's going to be on the surface of the ulcer. But yeah, with respect to the homeless, you're right. I mean, and I've thought about that often, and that is the environment that they're in, the cleanliness issue, the body hygiene. The resources that they have, I mean, there's so many things going against them. And as it pertains to venous disease, when you look at the homeless, when I'm driving around or walking and seeing them, they all have swollen legs, and a lot of them have that skin discoloration that goes along with venous insufficiency. But they can be very sedentary, especially if they have a lot of other medical issues or mobility kind of issues. So they're often sitting, in an upright position all day long on a bench or a chair or whatever. It's a terrible problem.
Yeah, and it's so interesting because I do have people that are outreach workers that know these folks and put a name to it and actually feel a sense of accomplishment when a doc will go out in the field and treat a wound or do something for that.
Sure.
Okay, we continue. This is our mailbag show. Dr. Juleff is Vein Clinics of Hawaii, as you know, and you can get your question answered and included in one of our shows by going to the website. VeinClinicsOfHawaii.com. 4 islands. Started on the Big Island. Came over here to Oahu a few years ago, and all kinds of really neat things are going on down there. And that's why we do these things that sort of unstructured, sort of a free-for-all. And this is one that we sort of addressed a little earlier on. This one that says, and I'm not sure if this is a gal or a guy, but my father has darkening of the skin on his lower legs. He says it's due to diabetes. But I've heard that it might have to do with circulation. Does he have a problem? We've sort of, talked about that for the last couple of folks.
Right.
If somebody says he has diabetes, maybe he does. I mean, doctors told him that. But that doesn't mean, does it, that everything is to do to his diabetes?
Right.
Yeah.
Right.
Wow.
And that's a very typical comment that we hear all the time. When people come in with the hyperpigmentation that we see that goes along with venous insufficiency, they rationalize it or write it off as being part of their diabetes or some other illness, or the fact that they have spent too much time out in the sun or whatever. But and part of that is it's not like they're doing it intentionally; they just don't know. Hyperpigmentation as a symptom of venous disease is something that we talk about all the time because it's not one of those things that most lay people just automatically know is due to, poor vein function. Again, people who have varicose veins, it's easy. They can see a dilated, abnormal-looking vein on the surface of their leg, and it's easy for them to say, "Oh, I've got a vein problem," but not so much with many of the other symptoms that we see, and swelling and discoloration of the skin are two very common ones that kind of fall into that bag that people don't know. They just don't know that it's potentially due to venous insufficiency. And, should somebody like that be, evaluated? Absolutely.
Okay. A lot of our questions today have been, answers that have, lots of different ways you can answer them. And I want to touch upon one thing, and this is a good question, but it'll help. We could do 5 hours of shows on this question alone. What are some of the changes, or wait a minute, what are some of the things that can be done to make my leg veins better? And I think that when you start talking about treatment, it's always a relief to people to learn from this show, our Vein Clinics of Hawaii show, that there is treatment. And pretty much any venous condition, there's an answer. And let's talk about that. I mean, because like we said before, it used to be a really, really hard surgical deal. Yeah. And now the way things are, it's a lot different.
Yeah.
Treatment.
Back in the day again, and when I was young, I can remember doing these procedures all the time. Our basic interventional or surgical kind of procedure that we did for people was surgical vein stripping, and surgical vein stripping meant that the patient was admitted to the hospital. The procedure was done in the operating room. They had a general anesthetic. Often they were in the hospital for 2 or 3 days. It was not a comfortable kind of procedure. I mean, there was a fair amount of discomfort, a lot of bruising, a lot of incisions made on the leg. I mean, I kind of feel guilty sometimes knowing that I did that a long time ago when I see some of our older patients come in and they have had surgical vein stripping in the past, and they've got these 2 or 3 inch incisions like all over their leg.
Right. And by the way, are those or were those back in the day? And even I do know that even now and again there is sometimes a reason to have it done that way. But is it something that you'd not only get in there and take the vein out, but then you'd have to stitch it? Oh yeah. I mean, this is not just a little cut, but it's a big cut.
Yeah, absolutely. Yeah. And one of the main veins, the great saphenous vein, that we don't take out of the leg anymore, was the vein that we actually stripped out of the leg. So we made an incision up near the groin, we made another incision near the knee, and then one by the ankle.
By the way, they didn't want to just come right out of there, did they?
Oh no. There was some resistance.
A lot of stuff was there tangled.
Yeah.
Sometimes didn't they go around things, and then they crisscross, get knots in there.
Yeah. So, we used to thread a stainless steel wire up that vein and tie it off one end and tie off the other, and then tie it to the wire, and then pull the wire all the way through the leg. So that basically has been replaced by a procedure that we do in the office that takes 30, 45 minutes. People come in, we clean off their leg, we do our thing, and again, it's a very short process. We don't put anybody to sleep anymore. I mean, the most we might do for people is give them a little Valium to give them a little sedation. It's not like they're asleep. But we use a lot of local anesthesia, and we keep it very, very comfortable for people. I think most people are pleasantly surprised at how with the lack of discomfort. But we do the procedure and wrap their leg, put a compression stocking on them, and they leave the office and kind of go on with their day.
Yeah, and that's what I love to attest to, because I've had it in other ways. And the last several go-arounds at Dr. Jula, pizza cake. I mean, as a matter of fact, every now and again, you just say, "Hey, while we're doing this, can we do some more?" And I want out of there. And then all of a sudden, she said, "Well, you're done." Okay.
Yeah.
Boy, that's great.
Yeah. Well, we do hear that all the time. I mean, every now and then somebody will say, "Wait a minute, are you done?" And we say, "Yeah," and they'd say, "Gee, I thought we were just getting started."
Yeah, I want my money's worth. I want it to hurt.
Exactly.
But gang, I hope that you're starting to see what we're doing. By the way, it is a fun place, and there's another thing that I've got to tell you. Obviously, Essential Services and Doc has been, really, really doing a lot of things in a lot of places for a long time now. But I've really come to really appreciate the staff, particularly in on Oahu, because that's who I see all the time. They are so good at making people feel comfortable.
Yeah. We really have a very great crew. I mean, everybody is very in tune with patient satisfaction and customer service, and we try to make it very, very pleasant for everybody.
Okay, gang. So next time you have a question related to your veins, you know what to do. Go to veinclinicsofhawaii.com and state your piece. Who knows? We'll get you on one of these shows. In the meantime, tell everybody else, and if you want to hear previous shows, once again, go to Vein Clinics of Hawaii. You'll learn a whole bunch there. So thanks for listening, and we'll see you again next time. Take care of those legs. You only have a couple of them. Let's treat them right.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.
Let me be straight with you. This is a radio commercial for 3 Small Business Insurance. The policy has no fine print. It's clear what's covered. So while you can't see the following scene, just know that this pet store is protected by 3.
Joe, did you leave the snake tank open?
Look, I don't want to point fingers, but yes.
It's biting me! Sorry, sir. I'm calling my lawyer.
They're going to need some help with this mess. Luckily, they have 3. No fine print, just exceptional coverage. 3 is a product of Berkshire Hathaway Direct Insurance Company. 3. No nonsense, just common sense.